happy to have you. Disha, over to you. Just give me 1 second. I'm quickly going to spotlight you for everyone.
Yeah,
Disha,
thank you.
unmute yourself. Thank you so much, Disha, for joining us. Looking forward to the session. I'm sure people are going to learn many things. They have a lot of questions, and I'm not going to take much time. I'm going to hand it over to you.
Thank you, Neha. Thank you for the introduction. And I'm also very excited to be in this session, and I will try to keep it as simple and understandable as possible. So I will be sharing my screen now. Just give me a thumbs up if you all can see it.
It's visible, Disha. It's
It's
already
visible.
visible.
Okay, perfect.
Now I think it
So
has. No, you have removed. Now it's not visible.
yeah. So the session today will be on plantar fasciitis and plantar fasciitis. First of all, before we start with the topic, I would first like to tell that in many of the diagnoses, these days it's not written plantar fasciitis. Rather, what is mentioned is plantar fasciopathy or plantar heel pain. So it all falls under same category. So as to avoid any confusion over here. So, before we begin with the topic, let's understand what is plantar fascia. So, as you all can see, that
Disha,
plantar fascia,
1 second. Disha, are you going to share the screen?
uh, yeah, I am sharing
No, it's
once.
not visible. Can you just share it again?
Yes, sure. Sorry. Okay. Now, is it okay? Is it visible?
Yeah, it's visible now.
Okay. So the plantar fascia, it is a tough fibrous band, as you can see. It starts from the heel bone here and it goes till the base of your toes. So this white band that is visible here is your plantar fascia. And any degeneration of this fascia is what causes pain. And it mostly affects this area. So the pain is usually in this area towards the big toe side. So that is what plantar fasciitis is. It is earlier believed that it is inflammatory in nature. That's why the term itis was there. But now latest research shows that it is more degenerative in nature. And that is why fasciopathy or plantar heel pain is the word that is used. And now there are certain facts that it is as frequent as lower backache, and it's mostly seen at the age group of 40 and 60. And the average heel pain episode, it can last longer than 6 months, and it affects 10 to 15% of the population. And approximately 90% of the cases, they are treated very successfully with the conservative care. The plantar fascia, before we get into the depth of the problem, we need to understand what is the function of the plantar fascia. So, A, it supports the arch of the foot. We have a normal arch present in the foot, so that is supported by plantar fascia. And at the same time, it absorbs the shock while walking, while running, so it acts as a shock absorber. The plantar fascia plays a very important role in the normal biomechanics of the foot. By that I mean that whenever we keep our foot on the ground, there is a certain way, there is a certain path that it follows. First of all, it's the heel that comes in touch with the ground, then the foot fall flat, then heel goes off. So this entire thing is called plantar biomechanics. So plantar fascia plays a very important role in maintaining the normal biomechanics of the foot. The typical feature that people with fasciitis or fasciopathy has is stabbing pain. And the pain occurs usually when you take first few steps in the morning, and with activity the pain subsides. But over the later half of the day, the pain returns. So that's a very typical feature of this pain. What are the causes of this pain? It is a very multifactorial causes are there, like overuse injury, anything that is repetitively causing strain on the plantar fascia, that leads to the degeneration of the fascia, micro tear in the fascia, and that causes the heel pain. In some people, the foot mechanics is very disturbed. They have genetically either a very high arch or they have a flat foot, a very atypical pattern of walking. So what happens is that disturbs the weight on the plantar fascia. It is more on certain areas and less on the other areas. So this also causes degeneration of the plantar fascia. Same way obesity. When there is a person who has more weight, of course the loading of the plantar fascia is much more, and that puts extra stress on the plantar fascia, leading to plantar fasciitis. Occupations such as factory workers, teachers, because their working hours are such that they have to stand for a very prolonged period of time, and that puts plantar fascia under a lot of strain, causing this pain. And age, as I said, it's most common between the age of 40 and 60. And there are certain type of activities or exercise, like people who are runners or ballet dancers, long distance running, dancing, aerobic dance, ballet dancing. These all can be the causes of plantar fascial pain. Whereas there are other contributing factors. So as I said that, if there is any injury in the leg, or in your heel, or people with hip fracture or any other fracture in the leg, what they start doing is they start limping, or they prefer a certain way of walking, and that disturbs the load on the plantar fascia, which and that overloading of the plantar fascia or disturbed weight on the plantar fascia leads to this problem. At the same time, if there is any tension in the hamstring muscle, so this is the hamstring muscle, the muscle on the back of your thighs, this is the calf muscle, and this is your Achilles tendon. So if there is any tendon, any tightness in these three groups, that also makes a person very predisposed to have this position, this problem. A rigid big toe, a big toe flexibility is very important in the biomechanics of the foot. And if the rigidity is there, then that also disturbs the normal gait pattern and can cause this problem. Same way, leg length discrepancy, where there is change in the length of both the legs, that also causes this problem. So the problem falls under two categories: acute and chronic. Acute is generally a very injury-induced kind of a pain that falls under acute category, and chronic is which is a very classic case of plantar fasciitis, which happens because of prolonged injury or continuous strain on the plantar fascia. So that is the chronic. And the symptom, as we discussed, there is mild pain on the bottom of the heel, especially when you are taking first few steps of the day, and the pain improves with few steps taken. After 15-20 minutes, the pain starts subsiding, and later, in the later half of the day, the pain usually worsens. When the patient comes to us, so these are certain things that we've observed that the patient generally complains of. A, that there is heel pain when they take first few steps in the morning, and this pain also occurs after a period of prolonged resting. Let's say if a person is sitting for a few hours, whenever they will get up from that position, they will feel the same kind of pain. Standing up for a prolonged period of time also triggers the pain, and activities such as running, jumping, climbing stairs aggravates the pain, and walking barefoot or in shoes that has that are flat or has a very poor arch support, that also gives a lot of pain to the people. The tenderness is usually present on the you can say towards the toe side. It's on the heel, but it is towards the inner side of the heel. And there is limited dorsiflexion, as in there is a problem when you will try to lift your toes towards the ceiling, that will be limited, and there will be tightness in the Achilles tendon. A limp may or may not be present, because people, just to avoid the pain, people start walking on their toes, or they start to pronate their foot. So limp may or may not be present. And many patients, they are generally those who have already, all of a sudden they have started, there is an increase in their physical activity. Suppose you're walking for 30 minutes every day, and one day you decide to run for 30 minutes, so that also puts undue load on the plantar fascia and causes this problem. So the goal of the physiotherapy rehabilitation here is, A, we want to reduce the stress on the fascia. I will discuss every point in detail. Second is, we want to increase the flexibility. As I said, hamstring, calf, Achilles tendon, they are three very important muscles that can affect plantar fascia. So we try and stretch all the muscles and make them more flexible. And then strengthening of the muscles, calf muscles, hamstring muscles, your inner deep intrinsic plantar muscles, all these muscles is something that we will try to strengthen. So now whatever we are going to discuss, so if any of you is having pain, these are the things that you need to keep in mind, and you can manage this problem on your own as well. So the first stretch that we generally suggest is this seated towel stretch. As you all can see here, this I won't be able to demonstrate it, but I will try to explain it with the help of figures. And if there is any problem, you can send a message, and I will try to explain it in much detail later. So a person needs to sit with the back completely straight. As you can see, this is the affected leg. You can bend the other leg if you have a problem in keeping the back straight. You need to just loop around a towel around your foot like this. Your fingers should be free and it should be till the midpoint of your feet. And then, with the help of your arms, you will try to stretch your foot. Move it close to your body, close to your head. And you will feel a tension or stretch here in this area. This is where your Achilles tendon is. This is where your calf muscle is. And this entire area is your plantar fascia. So, when you stretch, you will feel a stretch over here. Try to hold the stretch for 10 seconds and repeat it for, let's say, 3 to 4 times. So that's a very good stretch, and it is a very beginner level stretch. Suppose you are very symptomatic and having a lot of pain. So that is the first stretch that you can start with. And once you are comfortable with this stretch, then you can move on to the wall calf stretch. So as you can see, you need to keep your hands on the wall, or you can take support of a chair. And this is your affected leg. This is this leg which we want to stretch. And this leg is your unaffected leg. So in this position, when I will shift the weight of mine on, like I'll move the pelvis forward and shift the weight on the front leg, there is a sharp stretch that will come in this area. Again, the idea is to hold the stretch for 10 seconds. 3 times you have to do it. You can do it in the morning or in the evening. Now, this crossover fascia stretch, this is a very good stretch, and this needs to be performed in the morning, or especially when you are trying to get up after a prolonged period of sitting. What happens is, whenever you sit or lie down for a prolonged period of time, or you are sleeping, the rest tightens the muscle of plantar fascia, your calf muscle. And as soon as you keep your foot, your heel on the ground, it puts a sudden pull on the insertion point of the plantar fascia. And that sudden pull causes a stabbing pain. So if we, before keeping the foot on the ground, if you stretch your foot in this way, the way I'm going to explain now, you are not going to feel that stabbing pain once you keep the foot on the ground. So this is called crossover fascia stretch. So this is your affected foot. You need to cross your leg and keep your foot this way. And you need to hold your toes from this area and put a pressure towards your head in this direction, and hold the stretch for 10 seconds. So when you do this stretch, the fascia gets stretched. And when you put your feet on the ground, there is no sudden pull that is happening. And that is why you will not feel this pain. So I think this is the stretch that everybody who is having plantar fasciitis pain has to perform in the morning or after prolonged periods of resting. Now this is a progression. This particular exercise is for strengthening and stretching of your calf and plantar area. So this is the beginner level. You can take the support of a wall, or you can take the support of the chair or any other thing. Just stand straight with your legs shoulder width apart, and just try to be on your toes. Again, this is a progressive exercise. It is not the exercise that you will do in the beginning when there is a lot of discomfort. This can only be performed after 70 to 80% of relief. So you will stand on your toes, and so you need to hold this position for 10 seconds, 3 to 4 times. You can do it in the morning or in the evening. And this kind of stretch, the one that is mentioned, is shown here. This is to for the later stages, when you have recovered completely, and to avoid the episode from occurring again, we perform this kind of stretch. So as you can see, it can be performed on a stepper or on the stairs. Here in this position, the heel is going down, so this gives a good stretch to your calf area. And again, when you do this movement, when you come on your toes, this anti-gravity movement, when it happens, it not only stretches the plantar fascia, it strengthens all the intrinsic small muscles of your foot as well as your calf. So these are few stretches that you need to perform. Now here, as there are certain people who feel that there is a lot of relief that comes when they do ice massage. As I explained at the beginning of the session, that it is not an inflammatory condition. So ice massage is something that we as physiotherapists do not recommend very much, but there is nothing against it also. You can keep let's say a cold can of a soda can or anything, a bottle, and just roll it. So this gives relief to many as it causes numbness, and it alleviates the pain. So these are the few things that you can do. So the point that you need to keep in mind is, suppose today when I ask you that what is your pain level, as in on the scale of 1 to 10, if 10 is the maximum pain and 1 is like minimum pain or no pain, where would you rate your pain? And suppose the answer given to me is 4, and then you start performing these exercises. Next, if you come and say that the pain has gone to level 6, it means you need to go slow towards the exercise. You need to follow a very beginner level of exercise, like this crossover fascia stretch or this seated towel stretch. Exercises like this needs to be avoided at that point in time. You will slowly build up the strength in the fascia, and then that is how you need to progress. So it is a very stubborn condition to treat, and one needs to be really patient about addressing it. So do not get like doing 5 exercises in one go. Just choose one stretching or two stretching exercises and one two strengthening exercises. A combination of that is fine, and later on you can progress. And this one exercise, which is monkey foot towel lift, now this is a very interesting exercise because it's a very good strengthening exercise. It helps in increasing the flexibility, the range of motion of the toes, and it strengthens all the deep seated intrinsic muscles of the foot and the plantar fascia as well. So a towel needs to be spreaded in front of your foot, and with the help of your toes you will try and curl in that towel. Try to scoop it and fill it in the arch of your foot, and then you can try and spread it by spreading your toes. So this exercise is very, very interesting. You can try to pick up the towel also, holding it in your toes. Or later on you can increase the weight. You can use marbles also, and that also strengthens the muscles of the foot. Now, big toe. It's usually seen that big toe is very neglected when it comes to plantar fasciitis or fasciopathy. So now a lot of effort is made in adding strength and flexibility to the big toe, because it plays a very important role when we are standing and push off when walking or running. So during the push off phase, this is what how the big toe, the position of the big toe and foot is when we are walking. So around 90% of the control of our foot comes from the flexibility of the big toe. So as we push off, the big toe extends, and this tightens the plantar fascia here and provides stability and shock absorption. So if there is any lack or stiffness in this area, then the other toes has to take over, which because so as to compensate, and this causes pain, disturbance in the plantar fascia functioning, and that strains, causing the plantar fasciitis or fasciopathy. So to increase the flexibility in the big toe and to strengthen the big toe, these are the two things that we usually suggest. One is toe extension. It can be performed in the sitting position, lying down position, or in a position like this. The only thing you need to keep in mind is you are not supposed to hold your toe from here, from above. You need to hold the base of your toe from here, and you are going to extend it towards yourself. The pressure has to be this way. So once you do that, try to hold the stretch for 10 seconds, 3 to 4 times. So this is a very important stretch in plantar fasciitis management. And as we spoke about the towel curling one, so this is the same thing, that in this you are going to use more of your toes in scrunching the towel. So big toe mobility is important because it helps with the balance, push off, shock absorption, forward motion, injury prevention, and overall performance. Then comes the calf muscle strength. As I showed you in the previous slide, let me once again show you the exercise that you are supposed to do for calf muscle strength. This is the exercise that focus in building calf muscle strength. These days in gym there are many equipments, also machine weights available, that also can be used. So poor alignment of calf muscles can cause excessive stress on one area of plantar fascia and Achilles tendon, which usually leads to inflammation or sets in the degenerative changes and causes pain. So the standing calf stretch that I just showed you, it elongates the calf muscle and Achilles tendon, and it keeps the foot very flexible and prevents plantar fasciitis. So suppose you have plantar fasciitis right now in active stage, you can start with this stretch very slowly. And if it is something that is not active now, but you get it once or twice in a year, and it reoccurs very frequently, then this is the stretch that you need to perform daily. It is a strength. It is a very good strengthening exercise. So it reduces ankle range. A tight calf muscle reduces ankle range of motion, that causes abnormal stress on the foot, and it increases the stress on the plantar fascia also. So stretching of the calf muscle and plantar fascia can help increase flexibility. It decreases the heel pain. It prevents the plantar fascia from tearing, and it strengthens the supporting muscles and reduces inflammation. Whenever we do any kind of exercise, because of the exercise, the blood circulation increases in that area. So whatever inflammatory, degenerative changes or swelling that you might be having in that area, because of increased blood circulation, it subsides. So this is how exercise plays an important role. So if you are trying to manage your plantar fasciitis on your own, here are few things that you need to keep in mind and you can perform. One is deep friction massage. So what happens is when you are massaging your fascia with the help of your thumbs, or you're doing kneading massage of the fascia along the length of the plantar fascia, you are activating the mechanoreceptors there. As in the pain receptors, the receptor of a pain, their stimulus is very low, whereas the mechanoreceptor stimulus is very high. So as you are pressing, the mechanoreceptors is sending a very strong information to the brain, and the information of the pain is, because of low stimuli, is not felt by the brain. And that's how you feel better once you massage the fascia. It is Earlier it was believed that there are certain scars along the length of the fascia, and with deep friction you are trying to break those scars. But now it is proven that nothing like that happens. It is a very strong fascia, and no amount of strength, we don't have that kind of strength to break those scars. So the role of massage here is to just activate those mechanoreceptors so that pain is not felt. Then shoe inserts and orthotics. So these days you get various kinds of over the counter heel cups, or you get insoles, so you can use that. And if a person is having a lot of problem and there is a lot of pain when you get up in the morning, in such cases night splints are recommended, because it keeps the fascia in a stretched position overnight when you sleep. There are plantar fascia socks also that are available these days, so that can also be used. And sometimes the physiotherapist might decide to do some kind of mobilization in case there is a lot of stiffness and rigidity in your foot or along the other joints of the foot. Taping again prevents support. That is also one practice that physiotherapists might want to do it on you. Customized foot orthosis. These days, if you are working with a podiatrist, you are going to see a podiatrist, they might customize the foot orthosis for you. Night splint, as I said, it is there to stretch the plantar fascia and the other muscles when you sleep in the night. So to prevent plantar fasciitis, these are certain key points. Please make sure that you take good care of your feet, because it's often seen that it is a very our foot is a very important part of our body, but still it is very much neglected. So take good care of your foot, and wear shoes with good arch support and heel cushioning. These days all the brands, like various brands are there, that have upgraded their technology and specially designing shoes keeping plantar fasciitis problem in mind. So wear a good shoe. Make sure that you stretch and strengthen daily when you are whether you are an athlete or not. Maintain a healthy weight, because as increase in weight will put a lot of pressure on the plantar fascia. It's very important to maintain healthy weight, and avoid barefoot walking on hard surface, because that strains the plantar fascia. So please avoid that. Massage the plantar fascia. I explained to you about this point. Give sufficient amount of rest to your foot, and try physiotherapy. You can go see physiotherapist in case you are unable to manage it on your own. So we cannot neglect the importance of shoes, and we have to talk about this very particular aspect in the management of plantar fasciitis. What is the right shoe for you? A shoe that provides ample arch support. That is a good shoe. Takes care of your arch. There is sufficient cushioning, and high heels, flats, flip flops. They should be avoided as much as possible, especially if you have a problem. So when you are looking for a walking and a running shoes, here are few things that you need to keep in mind. That there should be plenty of toe room. It should not compress your toes. It should have a good arch and heel support. Shock absorption. This technology is seen in many walking and running shoes. So make sure that you buy shoes which has a good shock absorption. It should be comfortable. A cushion insole should be there, and the heels should be thick, because it reduces the strain on the plantar fascia. And when it comes to dress shoes in females, make sure that the footbed is very supported, and there should be good arch support. Like in flip flops, you see there is no arch support. So I hope you all can understand. There are certain footwears where there is a inbuilt arch in them. So look for that kind of soles, and avoid high heel shoes with narrow toe box, as they can exacerbate your symptoms. Flat shoes is a complete no. Rather look for sandals which has a contoured footbed, as I explained, which supports your arch and keeps your foot healthy. The do's and don'ts here, the things that you need to keep in mind is, if you have a very activated plantar fasciitis or heel pain, say no to stilettos, high heels, flats, or flip flops, and you can use insoles or orthotics. Don't wear your old shoes. Though the shoe might look very new, but the cushioning, the shock absorption in the shoe, it wounds off over a period of time. So try to change your shoe if you are an active runner or the one who goes for walk daily. After 6 to 8 months, is the time when you need to change your shoes. Break in your new shoes properly. So whenever you buy any kind of new shoe, before you start full-fledged activity or your exercise in those shoes, try to use them for 10 to 15 minutes in the house, so that your foot adapts to that new shoe. And that's how you need to break in the new shoes properly. Stretch your muscles daily. Always choose the right size and choose well. So the overall, as I said, feet is generally very neglected, and it is for everybody. Those who are having plantar fasciitis or no, these are the certain things that all of us needs to keep in mind. Always inspect your foot thoroughly. Just look for any signs of inflammation checking in the foot, or if there is any kind of color change. So take a good note of these things. Maintain good foot hygiene. Hydrate the skin so as to avoid cracks, and buy proper size shoes. Don't ignore any kind of foot pain if it's there. Cut your toenails straight across. Exercise daily. Even for your feet, you need to make an exercise plan and practices daily, so as to practices daily, so as to enjoy good feet health. One sec. I'm sorry. Yeah, and each day, because if you wear one kind of shoe for prolonged period of time and for many days, it might causes some disturbance in the arch. So buy comfortable shoes, but have 2 3 pairs, and try to alternate between
Disha, can
those
you put
shoes.
it in the presentation mode?
uh, okay. So yeah, I am more or
Top right,
less done
top
only.
right, top right. If you see,
One sec. Yeah, can you all see now?
हाँ दिशा थोड़ा ऊपर देखो उसमें प्रेजेंट का ऑप्शन है शेयर से पहले गो अप राइट हैंड साइड टॉप राइट आफ्टर कमेंट्स कैच अप प्रेजेंट राइट हैंड साइड यू कैन सी द ऑप्शन प्रेजेंट लेफ्ट हैंड साइड में फाइल होम इंसर्टेड राइट हैंड साइड इफ यू जस्ट सी देयर इज अ प्रेजेंट
Yeah,
ऑप्शन
yeah.
परफेक्ट थैंक यू
Yeah, so that brings us towards the end only. I was explaining that you need to alternate between your shoes, buy 2 3 pairs of comfortable shoes always, and try to alternate between those shoes. And one sec, I'm just going on to the last slide. Okay, so I think I more or less explained it. So that was plantar fasciitis for you, and if you are also struggling to manage with the pain, so I have tried to make it very simple for you. Just make sure that there should be sufficient amount of stretching and sufficient amount of strengthening that you are doing. The mistake that people do is they are either stretching and not strengthening, or they are strengthening not stretching. A combination approach here is a must. But you need, so there is no universal rule that you need to do 10-second hold, you need to do 5 different exercises. Every problem is different, every individual is very different. So just see, as I explained you 1 to 10 wala rule about the pain. Just make sure whenever you exercise, the next day the number has to go down, it has to be towards the better side. So if walking for 30 minutes gives you pain, try and walk for 20 minutes, and then see if that is okay with the plantar fascia. So a slow and steady approach is what is needed here. So I have tried to keep it very simple. If you have any kind of question, please ask, and I'll
This
try
was
to answer those.
informative, Disha. Yeah, we have certain questions, Disha, which I would be taking now.
Yeah.
Uh, So just give me 1 second. I think it was quite self-explanatory itself. We have majorly covered everything. So there's one question from Ruby that she has acute pain to heel spurs and plantar fascia, acute pain. And she has undergone like physiotherapy sessions with 10 different, like she has undergone 10 physio sessions. Looking forward to the suggestions to cure this sooner. Any suggestion for her from your side?
So if she has gone for the physiotherapy sessions, so that's all right. But is she putting a special emphasis on both stretching and strengthening exercises? Because they both has to be a part of a daily routine,
Mm-hmm.
and maybe twice. If both the things are happening on daily basis, then a slow progression. Try to build up slowly on those exercises, and that is when you will feel a difference. Actually, many people, they are coming for the physiotherapy sessions, and in the home they are not practicing stretching and strengthening combination. So this is the tactic that one need to understand, that is very important part.
Absolutely. I think everything was very, very self-explanatory. Anyone has any question which you want me to take up, please put it there in the chat section. Andrew has one question. Can a wooden spike roller be used to exercise the foot?
It can be, as I said, that it is like massaging the plantar fascia, and it sends a strong signal to the brain, and fades away the signal of the pain, and that's how you feel better. So if it is giving you relief, then please do that.
Okay. And another question from Andrew that how to differentiate between uric acid pain and plantar fascia?
So as I explained about, so if there is uric acid pain, that will be shown because that comes under gout, and it can be shown through the blood test also. Whereas clinically, how we assess is, I shared many points, like when a person gets up after a prolonged period of time, running, activity induced pain. So those are the typical features of plantar fasciitis. If all those are the tick marks, then that definitely is a plantar fasciitis pain.
Okay. And can you just tell that whether Epsom salt helps in the plantar fascia or not?
Can you please repeat the question? I couldn't hear you.
Can you just help, whether Epsom salt helps in plantar fasciitis or not?
It helps in relaxing the muscle. These days, people are have started using Epsom salt in water. It really relaxes the muscles around in the foot, and it relieves the pain. So it can definitely be practiced. You can soak your feet in the Epsom salt water, so it relieves the pain.
Great. I think Disha, it was like wonderful session. And last question from your, from my side, that if there is any takeaway that you want to give to the listeners, so that they remember that how to take care of the fasciitis and the major issue, which is the heel pain. Any suggestions or the takeaway that you would like to give it to them?
Yeah, I think the only suggestion that I would like to give here is exercise. So, as we design a workout plan for our upper body, lower body, feet is often a neglected area where there is no exercise plan designed by any trainer. So, just make sure that your feet is getting enough exercise. You are strengthening your feet muscles on daily basis. You are stretching your feet muscles. That will help you prevent the reoccurrence as well as from getting plantar fasciitis pain in future.
Thank you so much, Tisha. I think everyone must agree with me that this session was full of information and full of knowledge. You might have learned many new things. And if you have a knee, heel pain now, you know what you need to do and what you don't need to. So we are going to share the PPT and the recording, everything with you. You can go through at any point of time. Thank you so much, Tisha, for joining us today and sharing your insights and knowledge with us especially on the World Physiotherapy Day. Wishing you all a happy World Physiotherapy Day. Take care of yourself. Do not miss to exercise. I know many times we give, complete excuse for the exercise. Please come out of those excuses and take a step forward and, move ahead in life. Uh, we make out time for everything, for eating out. We give excuses to cheat, but we don't give excuses to eat. So to exercise. So please make sure you give yourself excuses to exercise. Um,
So
Anything, Disha,
thank
you
you.
want to add up for the sciatica? People are asking.
See, sciatica pain is different from plantar fasciitis because it is more back related or a nerve compression thing. If there is a sciatica pain, then there is a different altogether a different management of that, because it's a nerve compression that is happening, and we need to release that nerve from getting compressed, and there is a set of exercises that we perform. So sciatica pain coming in the foot is a different problem, whereas this kind of plantar heel pain is more localized in the foot area only. So if you have sciatica pain, there is all, maybe Neha, you can have a different session on that sciatica pain,
Definitely.
because it's a very vast topic in itself.
Great. Thank you so much, Disha, for joining us today. And it was a wonderful session. Thanks a lot
Thank
once
you
again.
everyone.
Thanks to
Thank you for
everyone.
your valuable time on Sunday evening. Thank you so much.
Thank you so much, everyone, for joining us. See you again tomorrow with another session. Don't miss that. This is a hip mobility session for tomorrow. And I'm sure that we do get a lot of hip pains and hip injuries at this age. So do not miss it. Do join us positively. See you tomorrow. Good night.